All right, thank you for coming tonight. This is Charles City 2 of 2 of our town hall meetings. Makes number 11 for our strategic communications. We have made a concerted effort to get to all points within Floyd County. So in late September, we started in Marble Rock on the 21st of September. And we'll end up, our last town hall will be next week in Nashua. We'll talk a little bit about why Nashua. And then we have Lions Club on the 28th of October. And that'll give us 13 presentations of community-supported EMS system for that. So we've covered a lot of miles, talked to a lot of folks, and our goal here tonight is to provide some education on the EMS system and the EMS tax levy so folks can make a concerted, educated decision on the polls on 8 November. So the community-supported EMS system is supporting the needs of the citizens in Floyd County. We'll talk a little bit about what comprises of Floyd County. So we have North Springs, Rudd, Marble Rock, Floyd, Hallowell, Rockford, Marble Rock, Charles City. Okay. So first part here, we're going to talk a little bit about what EMS system, what type of EMS system we have within Floyd County. So in Iowa, there are 4 primary levels of EMS providers. You have the paramedic, the advanced EMT, the EMT, which is emergency medical technician, EMR, emergency medical responder, and then we have additional critical care paramedics and field RNs. One thing I really like about this slide to point out is that in Floyd County, we have all levels of this care provided between the 4 agencies, but not all levels are guaranteed. And we'll talk a lot about that as we go through the slides. So we're going to talk about what comprises the EMS service and the EMS educational needs currently in Floyd County. So we have the Floyd County EMS Association, and they provide EMS education and training. We've got North Springs Volunteer Ambulance, BLS Transport Service. And as we go through these, it's important to pay attention to the service that each one of these provide. We'll talk a little bit about that. And so with North Springs, it's a volunteer ambulance, it's a BLS transport service. Marble Rock Fire and Rescue, BLS non-transport service. Something nice with that, Brian Chambers, who's on our council, he heads up the Marble Rock Fire and Rescue BLS non-transport service. They just got a nice donation from First Security for $7,000 for towards a new truck. Up on the left, as far as North Springs, that's Dave Luke. He's the manager for the North Springs Volunteer Ambulance. We have American Medical Response, AMR, right out of Charles City. We have our station manager, Dawn Staub, here tonight. And we have Green. We have Jeff Sterling out of Green. He's also on our EMS Advisory Commission, and they are a BLS transport service. So the key things I want to point out here, North Springs is a BLS transport service. AMR is an ALS, so Advanced Life Support and Basic Life Support, or BLS transport service. Marble Rock and Fire and Rescue is a BLS non-transport service. Green Volunteer Ambulance is a BLS transport service. So there's two types of life support, is the ALS and the BLS. So Interesting story to pass along. Marty happens to be in here tonight, and he shared me a little bit of a story a couple weeks ago. A gentleman that was in southern Floyd County was having some very troubling heart issues, heart attack, a larger gentleman, and you got him stabilized, and you were able to perform CPR for quite a while. You administered 3 bags of medicine on him, and the result of that is he's alive today.
That's what we knew.
Pardon?
That's what we knew.
Yeah. So the key things here is for EMR, they provide the ALS and the BLS transport service. So ALS is on call 24/7, the BLS is on call, correct, Don? North Springs is a BLS transport service, so they're providing basic life support, and they can transport Marble Rock Fire Rescue. They're a basic life support, but they're a non-transport service. So that means they can provide the first aid, but they can't transport. So they'll be on scene, and they'll be waiting for, say, AMR to arrive, and then take over, provide any additional advanced life support, and then transport that patient to the nearest hospital. Green is basic life support transport service. And again, we round that out with the Floyd County EMS Association, EMS for the education and training. So when I first started this, it was like, okay, why is green on here? Green's not in Floyd County. So a little education that I learned along the way. Green, Jeff Sterling heads that up, and Green Volunteer Ambulance actually covers about 100 miles of territory in southern Floyd County. So if you ever go to the town of Green and on Highway 14, 1/8 of a mile, I think, outside of Green, you're in Floyd County. So there's a lot of Floyd County residents just to the north of the town of Green. So that was a little bit of an interesting point to convey there, why Green is part of the Floyd County EMS system. Okay. Floyd County current EMS annual responses is 1,500 plus every year. So I'll tell a little story each time we go to one of these events. Is Sunday seems to be my EMS day, where I work on my weekly report, get that sent out, look at the schedules, make sure everything is lined up for the following week. And I'm sitting there, and I got a scanner at home. It's 9 o'clock in the morning, and the scanner goes off, and then they're paging the first ambulance. 10 minutes later, the scanner goes off again, they're paging the second ambulance. 10 minutes later, the scanner goes off again, third ambulance is paged. And within 30 minutes, 3 ambulances were paged out. Is it something on Sundays or what? But that shows that need there. It could be quiet one day, and then on a Sunday morning, you got 3 calls there, and right away. Last night was a very interesting night as well. There was like 3 or 4 calls within an hour or a 2-hour time frame. But what do those 1,500 calls really represent? We'll talk a little bit about those. So we have 1,500 emergent and non-emergent responses. So we have medical and trauma-related 911. So that's what everybody really associates EMS with is, okay, I'm on the floor, I can't get up, but there's a phone next to me, or somebody's cut and they're bleeding. So we pick up the phone and we call 911. And then dispatch takes over, and then an ambulance arrives. Medical trauma make up a lot of those 911 related calls. Something that we all can relate to locally, statewide, and more importantly nationally is mental health. Mental health seems to be somewhat of a crisis, but we have a lot of mental health related calls for service. Long-term care, long-term and residential care transports. We also have the hospital transports. Special events, fire standbys. So if there's a 4-alarm fire where 3 or 4 different fire agencies are responding, you're going to see EMS there. County fairs, school events, community events, sport events, Friday night football, one of my favorites. If you go look in the corner of the end zone, there's an ambulance there. Any law enforcement high-risk events. We have one person on our EMS Advisory Council has a daughter that teaches up in Rochester, and they had an event happen up there. They're all in the auditorium, and then they can't leave the auditorium, but you look out in the parking lot, it's flooded with law enforcement, but what else is there with law enforcement? It's the EMS. So those are comprised of those 1,500 emergent and non-emergent responses within Floyd County that we see every year. Sources of current supplemental funding. How is EMS funded currently? Municipality and townships provide funding. So we were in North Springs. We've done 2 town hall meetings in North Springs. I'll use them as an example. They get funding from their township a little bit, and they get a little bit of funding from the municipality or the North Springs. The city of North Springs provide funding, but it's not very much. Charles City and Floyd County General Fund, we'll talk a little bit about that. Currently, Charles City and Floyd County split it 50-50, so it's $100,000 a piece or $200,000, and that comes out of the general fund. And we'll talk why it's important to focus in on the general fund there. Grants. A good example was Brian Chambers received $7,000 to go towards a new truck out there. That's one type of endowment that we can receive. A lot of grants go in for various equipment. And another one that we're all common to seeing is fundraisers. So last Sunday, the fire department just had their annual, or twice a year, I think, once a year, pancake breakfast. Some other departments do soup suppers, so that's another way of generating funds for either fire department or for EMS. What are the hurdles facing the Floyd County EMS system? We can break it down into 4 key areas, but in actuality, as you see those, they're commonplace in the workforce today. EMS is just a recipient of that. If you go to any business in town or within the county, you're going to see the same thing. Total operation costs are increasing. Take a trip to the grocery store. Eggs are up 50%. Other commodities are 30-40%. You go to the gas pump, you get sticker shock on how much it takes to fill your vehicle up. So overall, total costs are increasing. It was amazing it was eye-opening for me. And we're going to talk a little bit about the costs, but as the Ambulance Commission started back in March looking at the cost for, do we renew our AMR contract? We have an option to start an in-house piece. And one of the things that a lot of the counties are realizing is it's very, very expensive. So a rig alone with nothing in it, no medical gear, I think it's about $250,000, something like that, or $150,000, then you can easily add up another $200,000 just on the gear to put in it itself. That's the total operating cost increasing. It's not cheap. Declining volunteerism, we see that everywhere. A lot of great community civic organizations right here in Charles City. If you look at those folks that dedicate their time and energy to those, they're not young. So that's a concern. the declining volunteerism, there's kind of another avenue to look at too, is cost is right now just to be certified for EMS, it's $2,000. And that's the cost, but then you have to take, you have to be certified. So can folks that are interested in volunteer, can they afford that? So that's a big chunk of money to say, yeah, I want to be part of the EMS system. Can I afford that? What happens if I don't pass the certification process? Workforce shortage, that's common everywhere. It's quality workers coming in, showing up every day, putting in a full 8-hour day. Insurance reimbursement shortfall. This was another eye-opening piece for me was what is the return rate? So you would think it would be when an ambulance is called out and they take a patient and the billing process and insurance comes in, you got the co-pays and how many different insurances, but what is actually collected out of that is roughly, I think, about 50%, if you're lucky. So there's a lot of challenges with the Floyd County EMS hurdles, and it's just in a lot of different categories there. So what does this EMS tax levy mean to you as a taxpayer? So we'll take a little bit back about this and do a little more background here. So in June of 2021, Governor Reynolds signed Senate File 615 into law that enabled the counties to declare EMS as an essential service. From there, the Floyd County Board of Supervisors took an action on that, I think in June.
June, we had to give a 60-day notice that we would consider a resolution. So we did that in June. We then considered the resolution about the middle of July, had to read it three times to meet the code, which we did at 3 consecutive meetings, and it passed on August 1st.
Yep. So we, as a council, EMS Advisory Council, right now there's currently 7 members on that council. And as we talked about the different agencies that make up the EMS system within Floyd County, you have Dave Lute out of North Springs, he's on the council. Ryan Chambers out of Marble Rock, he's the fire chief over there, he's on the council. Dawn Stott, our AMR station manager, she's on there. Roy represents the Floyd County Board of Supervisors. I represent the City Council, Charles City City Council. We have Dawnette Willis, who represents the Floyd County Memorial Hospital. So we have a well-rounded group of folks that, from a county perspective, from a city perspective, from AMR ambulance perspective, and all of the different entities there. The thing, before we get into the cost piece, and this is something that we have received a lot of questions on, is cost. As Roy mentioned, we didn't just come into August 1st and say, it's going to cost $556,000. We didn't come up then. We did formulate as a council. We were put together in August, but all of those folks that I mentioned, we have actually been attending the ambulance commission meetings that actually started at the end of March, and have a good vested knowledge of what those costs were as they began to be formulated, and then when we formulated as an advisory council, we had a very good idea of what those costs would be. And then we also had each of those entities, North Springs, Marble Rock, Green, the Floyd County EMS Association, also provide what they felt was cost to provide EMS support, not only today, but tomorrow, and tomorrow being 10 years. And that's hard to do. How do you factor in costs from now or out to 15 years or now to 5 years or 10 years for that? We did that. one of the things that here is, there's three things to key on, is the word maximum. So Senate File 615, Iowa Code 422D, and there's actually 6 chapters or 6 sections of 422D, and it talks a lot about how the whole EMS tax levy can be administered from a voting perspective, what happens with the funds, etc. I think from a it has a good deal of detail in there for Iowa Code. So we do get a lot of questions, and we'll kind of talk about those. But it's what's the maximum revenue that could be generated, and that's $556,000. Where did we come up with $556,000? We didn't just say, okay, well, let's just figure out what it would take to do A, and it was just $556,000. So we were looking at what the cost would be for going forward. And when we sat down as a council, we came up with 3 objectives. What would the cost be? What should the periodicity of that levy be? And how should we communicate that out to the general public of Floyd County? So we looked at the periodicity first. We could have went 1 year, we could have went all the way out to 15 years. We actually looked at 5, 10, and 15-year increments. 15 years, we looked out and said, that's just too hard to estimate cost that far out. There could be so many changes that there's no way to really factor in or know what those changes could be. On the other end of the spectrum, we looked at 5 years, and we felt as a council that 5 years would not be enough to see enough change in cost to do that. So we looked at 10 years. 10 years seemed to be about the right number for that. So that was what was that was part of the recommendation of the Floyd County Board of Supervisors was for the EMS tax levy that will be on the ballot November 8th. 10 years was the nominal periodicity for that. And then the cost of $556,000. One interesting thing within Chapter 422D, it provided 2 mechanisms for the EMS tax levy. Once Floyd County declared EMS as essential service, when doing that, established the EMS Advisory Council. The EMS Advisory Council then was tasked with coming up with cost and the periodicity and how that cost could be collected. So there was the 3 things. In there, in Chapter 422D, you can go up to 0.75. So we could have actually taken the easy way out and said, let's just not do our homework. Let's just put 0.75 and call it a day, and we'll collect all the funding we can from 0.75. We opted not to do that. We looked at what would it actually take to generate $556,000. And that came up to 57 cents per 1,000 of assessed property value. We also looked at, there's a second option to collect that funding source for EMS, and that's a local option state income surtax, and that has a maximum rate of 1%. So as a council, and through the Floyd County Board of Supervisors, there's 2 mechanisms to generate that funding. What I like about this is the second key word there is maximum. We could have taken the easy way out and said, hey, let's just make it 0.75 and get as much money from the taxpayers as we can. And that's not what we wanted to do. What was the property tax that would be needed to meet that $556,000? So it came out to 57 cents per 1,000 of assessed value. For example, a $100,000 home would have $30.78 annually. So on the ballot in November 8th, it will be both property tax of 0.57 and the local option state income surtax of a 1%. And I like that. And there's a key point here to know is the whole burden is not on the folks in Floyd County that pay property tax. So part of that will be reduced because we'll be a source of funding will be via that local option income surtax. And I think our estimation is about 120,000.
Yeah, the Department of Finance, the State of Iowa Department of Finance estimates that if we had collected 1% on that local option state income surtax this year, we would have collected about $120,000. Probably over the next 4 or 5 years, they're estimating that it'll drop to closer to 100,000. So some of the keys here is that, yes, we're using 0.57, and at the current property assessment rates, that 0.57 would generate the entire 556,000. But if we can generate 120,000 through the local income surtax, then if we decide to recommend to the supervisors, and the supervisors decide that is the amount they want to try to collect, that would reduce that 556 from property tax down to 436. So that it would reduce that 57 cents per thousand as well to meet that number. But Patrick is 100% right. These are all maximums, and the maximums were set to try to live through that 10-year time period. And so the first year, and we're going to have to sit down and do some calculating, but the first year it may be less than that 556, and then it may increase. It is one of those things where we want to make sure that we try to put enough in there so that we can get through the entire 10 years. But we also don't want the taxpayer to be paying more than what we think is the appropriate amount for EMS. Another thing that comes up at all these meetings, and I want to make everybody 100% aware of, the code is very clear. These levies, either the property tax or income tax, if it's passed, can only be used for EMS. They cannot be used for anything else. So if there's carryover, which there most likely would be if we do a good job, there'll be some carryover. And so that money at any time through the 10 years or at the end of the 10 years, if there's carryover left over, it can only be used for EMS. It cannot be used for gravel on the roads. It can't be used for properties within Floyd County, the county properties. It can only be used to supply EMS within Floyd County.
Very good point. So a common question that we have is how does that break down? So how does that 556,000 break out to all of the different entities within Floyd County EMS? So 440,000 of that is from an estimation from the Ambulance Commission, looking at the current cost for a 24-hour ALS and on-call BLS. But also you have to factor in the manpower, the equipment, capital expenses, training, education, insurance, all those types of things also factor into that. Out of that, 20,000 was requested from, or the estimated cost for the Floyd County EMS Association. So we talked a little bit about at the beginning of the volunteerism, the shortfalls, the cost of obtaining EMS certification. So that was a projected cost to try to build up the number of volunteers for EMS, to include the training, the cost of the training and the education. We did talk a little bit at the beginning. It's about $2,000. So somebody that's interested in becoming EMS, they may not have that $2,000. So that's something down the road we look at is if this passes, and that person is given, $2,000 to obtain their EMS certification, then how long do they have to provide service back to the county to fulfill that obligation on that? Next one up was $22,000 from Marble Rock, and it was mainly funding towards their capital improvement, which was a truck, pagers, and basic equipment to provide their non-BLS transport. $40,000 was from North Springs, and they have the BLS transport service. And similar to Marble Rock, a lot of it was replacing pagers, putting funding away for capital improvement, a new ambulance. One of the nice things that they did in their request is to look at a neat way of trying to retain their current volunteers or entice new ones, is adding $1 if they're on call. Do you want to talk a little bit about that?
Yeah, currently they're on-call people, they are required to be on call either 8 or 12 or 24 hours, whatever they sign up for. And they do that strictly voluntarily, no compensation. I believe they do get compensated if they have a call, but it's a minimal compensation. We never did really discuss that. But what they wanted to do was they wanted to start paying their people $1 an hour to carry that pager and say, I will be available to respond to an EMS call. And so once they put their name down on there, if it's for an 8-hour time period, they're going to get $8. And hopefully that will help offset, I think about things like child care, making sure I've got somebody that will take care of my children if I have to have a call, if that's the case. Whatever, it makes them, hopefully it helps them justify a little bit if I miss something, and because I'm carrying the pager and I can't go to some kind of an event that I normally would have gone to. So it's just a little thank you to them more than anything, but yes, that's what that was about.
Yeah. And the last one is $50,000 from Green. Similar maintenance, replacing the pagers, funds. This one here would be a little bit different because Green would be requesting funding from Floyd County, but also Green, the city of Green would have to be brought into the equation, so would Butler County. So and we're going to talk a little bit about here in a minute, how are these costs captured and the transparency and all that. So if we fast forward to November 8th, the EMS tax levy will be on the ballot, and it takes a 60% majority vote to pass. So if that tax levy passes, and we hope it does, the first thing that the EMS Advisory Council has to do is sit down and start formulating formal requests for funding. So we'll have a series of meetings coming up after November 8th, and then we are tasked to provide a report to the Floyd County Board of Supervisors by January 1st, what those itemized costs are going to be. So we talk about AMR, we talk about Green, North Springs, Marble Rock, and the Floyd County EMS Association. These are projected costs, so we'll have the actual requested costs documented. They'll be itemized in various categories. It'll be vetted through the advisory council. The advisory council will then take and generate that report, and it'll go to the Floyd County Board of Supervisors, who will then take that in as far as their budget season, and they'll work those numbers. So the report would be available to the Floyd County Board of Supervisors, which would also be available to the general public. So let's fast forward a year, and we're into the first full year of the EMS, and we have received these agencies have received some funding. So then the following year would be a kind of a two-part report where it'd be an itemized list of the expenses. So what was requested, we'd have to show what was spent, and then the request for additional funding for the next fiscal year. So you will have complete transparency over those funds. As Roy mentioned, Iowa Code 422D, very specific on how the EMS tax levy funding happens, and as leftovers, the Iowa Code 420D calls it a trust fund.
Trust fund.
Yep. So any leftover funding, so say for example, year one, the request is for $280,000 or $330,000. That 0.57 would come down.
Right.
And so it wouldn't be automatically going for $556,000 the first year. It's whatever the required cost is, and that levy rate would be set based to attain those costs. And then you would have to offset that cost with the the state income surtax.
Yes, and so if for instance, and you use a good example, if the first year the advisory council makes a recommendation to the Board of Supervisors and says, because it is a maximum of 556, they very well could go in and say, okay, well, we think 330 is a good number, or 350. But if they pick that number and then they recommend that to the Board of Supervisors, then that's the amount that would be collected. Then through the year, as the agencies look at it and go, well, we've got cost of this, some of them will be at the end of the year probably, and they'll look at it and go, we've had this cost, and they'll show expenses and why they need it, and then the advisory council will put together this request to the Board of Supervisors to support these agencies to those levels. Now, it may not be the level that they initially put in their budget, because if anybody has followed a budget, we put a budget number together and we go, okay, well, we think we can live within that number through the year, but a lot of times we don't spend that much. And to give you an example, Norris Springs Ambulance put $10,000 a year in for a replacement of an ambulance. Well, they're not going to take $10,000 and replace an ambulance every year. They're going to want that fund to build. So that's going to be one of those carryover numbers that will automatically go into that carryover balance for however many years it is, until they decide they do need to replace their ambulance. So that's an example of how that carryover be. I want to touch on a couple other things that, Patrick's done a great job here. We don't want to slight any of our members. One is Brandy Molitor, which is the Floyd County EMS Association, and the other one is Sterling.
Oh, Jeff.
Jeff Sterling.
Yep.
From Green Ambulance Service. And the reason that we have Green Ambulance Service sitting at the table is they are supplying EMS services, and they use a number of about 100 square miles in the southwest corner of Floyd County. And so the citizens of that corner of the county, if we didn't include Green into it, they would say, we're getting ambulance service, though we're going to be paying for part of this, and we're getting ambulance service from someplace else as our first response. Now, American Medical Response does respond countywide, some places as a backup ALS, some places as a backup ALS. But they do respond countywide, But Green Ambulance, as a primary response, does have a territory within the southwest corner of Floyd County. And that's a confusion. Some people, if you don't live down there, you may not realize that.
Thank you for sharing that. Some of the, this is where we go into some of our common, frequently asked questions. We kind of like to talk about those. One major one is what happens if the EMS tax levy doesn't pass? So the EMS Advisory Council would be dissolved.
It will be
essentially.
dissolved.
Yep. And we go back to where we are today, where the city of Charles City and Floyd County are 50-50 on the total cost for the EMS, and I think the county provides some funding to
Green Ambulance and also to Norris Springs.
Yep.
And Norris Springs does get some funding from the city of Norris Springs and from the township that they, I think they actually cover more than one township, but they get some funding from the townships that they give primary response to. And so it will be a burden that, that these elected officials in those particular areas will still be trying to figure out how to pay for EMS service. As we said, it is only increasing. When you look at this number, we know that that today, this year, it isn't going to cost us $556,000. But we look at 10 years out, it's going to cost us that and then some. And so the elected officials in either the city, county, cities, county, townships, in the future will have to decide, can we keep affording what we're doing? And if we can't, what are we going to do for our citizens? Because I've never talked to an elected official today yet that says we're not going to have EMS service. We all believe we are. The question in my mind is, what is that level of service? And through this whole process, the last 6 months or so, almost everybody across the board says, we are comfortable with the level of service we have today. I've never heard anybody say we should be reducing service. We've talked about increasing it, but we don't feel that it's justified for the cost to our taxpayers at this time to ask them to do that. And so, but everybody's comfortable with what we're doing. Again, nobody is talking that we should have less EMS service. And the problem we're running into is, how are we going to pay for that into the future?
And a good note is, if you take a look at EMS and costs going back to 2018, at a point in time, the city was paid to have an AMR service here in town, and so that's changed as regulations have changed. So a good note to the public as well is, up until this point, I think 218,000. I think we paid something to that effect so far for the EMS services between the city of Charles City and Floyd County, plus the other entities. A good point, as Roy made, is those long-term costs. We talked about increased operational costs. You could be, it could be 400 out at 10 years. It could be 440,000 plus. So if this EMS tax levy doesn't pass, how does and the funding for EMS keeps coming out of the general fund? How does the city and the county keep paying that, taking out a general fund, without having to look at reducing services elsewhere? And that's going to be a challenge if this tax levy doesn't pass.
Right. And what I really like about this is that it is going to go out to the public. They are going to have the ability on their election to decide whether or not this is a good way to fund EMS. And And it does take a 60% vote, and it is going to be up to the citizens on whether or not this moves forward. The other thing that we talk about, the cost going up. Remember, it isn't just AMR that talks about the cost going up. We've got other people involved in this. We've got North Springs Ambulance, we've got Barbara Rock First Responders, we have Green Ambulance in this. And all three of those agencies talk very strongly about that they're slowly going underwater. They're slowly drowning. And so they don't know how the future will keep moving forward without some type of a funding stream. And this is not a Floyd County issue. This is a statewide issue. This is a national issue. And and unfortunately, there's nobody stepping in. At our meeting the other night, somebody said, why isn't the state stepping in? They're not. They've given us an ability to move forward with a funding stream. And that's all we're trying to do right now is ask the taxpayers, do you want to move forward with this funding stream?
Thank you for that. Another common question we got, are there other counties considering this EMS tax levy? And the answer is yes. There is one that already has it, and that's Wharton County.
Wright County.
Wright County has it. And
Yes.
there's 8 others that are in the process of looking at placing EMS, declaring EMS as essential service.
There's probably that many that are going to have it on the ballot in November, and there are multiple ones that either are considering declaring their county EMS an essential service or have already done it, but haven't been able to put the numbers together to put it on a ballot yet. An example of that is because Jeff Sterling from Green Ambulance serves on both our council and also Butler County's, and Butler County has been working on this since, I think they passed their essential service back in March or so, and they will not have it on the ballot yet this fall because they can't come to terms on numbers.
Yep.
And so I will say our county is got a real leg up on that because we have some good services. They came together, they put some numbers together, and so that's how it ended up on the ballot this fall.
Questions? Okay. Thank you for your time.
Thank you.